Today I stand to address a concern that touches the heart of my community, the impact of Sea-Tac Airport on our lives. The noise cuts through the quiet of our nights, the relentless flights over 1,000 per day, and the pollution that includes these ultrafine particles that penetrate our lungs. These are not just inconveniences. They are challenges to our health and well-being. The bills are a call to action, inspired by Dr. Martin Luther King Jr., because he said that an injustice anywhere is an injustice everywhere. We seek justice and healing for our community. I want to give you a little bit of background of the work we've done and how we got to the bill that's in front of you. We call it the trifecta for change, and it's government at all levels, the federal, the state, the county, the cities. It's our university, the University of Washington, and most of all, our community leaders that have been making their voices heard for many, many years. Back in 2017, I was approached by Stuart, who's here today. We have a very high rate of asthma in our area. In fact, if you look at the map of the concentrations of ultrafine particles and the maps of children that go to emergency departments, they line up, very much so. And so we had a move-up study funded through the University of Washington. They had looked at the impact at LAX and Atlanta, the footprint, and they did that work in Sea-Tac. And what they found is that there's a high concentration of ultrafine particles, and you can distinguish them from other types of pollution. Then the next year was the healthcare impact study that was done by the Department of Health, and that was referenced by Karen Kaiser. And then in 2020, we did a bill together to allow the fixing of failed packages. In 2021, we looked at our schools, and the University of Washington went and looked at pollution outdoor and indoor in our classrooms. And what they found is that 50% or more of those ultrafine particles make their way indoors. And they're not mitigated by HVAC systems, but when you put in air purifiers, it can reduce that by 70%. And so that was very effective intervention. And then this last session, we did the asthma impact. Again, we have very high rates of asthma. And so the University of Washington is working with the King County Department of Health, reaching out to South King County families that have children with asthma. They'll be looking at the indoor air quality, the use of HEPA filters, and how that impacts the health of the child. We also had more monitoring. We had no monitoring of pollution, and we now have an EPA grant through Puget Sound Clean Air, and we also are including money so that they look at ultrafine particles. So the bills in front of you will do three things. They will expand HEPA purifiers. We'd like to see those in all schools, daycares, senior centers. We also would like to see more indoor spaces for recreation. The second thing, it'll protect our green spaces. Trees and parks are really important to our area. We need to protect those, especially old growth trees. The third is to help our residents in the community, starting with people with failed port packages, and you'll hear about that today. Senator Karen Kaiser and I met with Mr. Lee, and he's been waiting 8 years for his package to be fixed. He cannot see through the windows of his house. They're infested with mold. And he's there caring for his wife. So how will we pay for these things? The mitigation, and of course we want the mitigation to expand beyond where it's currently provided. One is we think the healthcare climate change dollars under air quality and health disparities is a source, especially around the air quality and the HEPA purifiers. So we are trying to advocate that those could be a source to expand. We also are looking at a portion of the property taxes that the port brings in as one of their revenues. And we're looking at this because they're not allowed to use federal dollars to fix these port packages. So having another source of funding is really important. We know other areas, like Senator Kaiser mentioned, have used other sources, their own dollars for this work. So we want to invite the port to be part of this trifecta and a partner as we seek these solutions really to heal our communities.